Hi, my name is Deidre Bentley with Complete Dental Health, the office of Dr. Timothy Collins, located in the Hillcrest neighborhood of San Diego, California. Today I will be answering for you the number one question that we receive from patients who are considering Invisalign treatment, and that is, how much does Invisalign cost? It doesn't surprise me that this is such an important question, because oftentimes the financial component can be the make it or break it piece that will allow you to start on your Invisalign journey. Additionally, it can be a little confusing. There is a lot of paid marketing out there geared towards people who are considering Invisalign treatment. Oftentimes, you can spot this by them offering huge deals off of their Invisalign treatment. So, $2,500 off Invisalign treatment or $1,500 off Invisalign treatment. I would just caution everyone that a lot of times the only way the providers can actually give such big discounts is by either marking up their cost of Invisalign to begin with or applying it to portions of treatment that no reputable Invisalign provider would ever charge you for. With all that said, the cost of Invisalign treatment at Complete Dental Health is between $3,500 to $6,500. I know that sounds like a big range because it is. Your individual cost of Invisalign treatment is going to be based on the complexity of your case, the time that you'll be in treatment, and your overall oral health. At Complete Dental Health, to help you answer this question, we offer complimentary Invisalign consultations that are pressure-free and allow you the opportunity to meet with Dr. Collins and find out what your exact fee for Invisalign treatment will be. This is also a great opportunity to see how Invisalign can fit into your life financially. At your consultation, we will have people that will be able to review with you the many different types of payment plans that we offer in our office and also through third-party companies such as CareCredit. I'd encourage you to contact our office today to schedule a complimentary consultation so that you can find out once and for all how much Invisalign costs for you. Hi, my name is Deidre Bentley and I work at Complete Dental Health with Dr. Timothy Collins. Today I'm going to be reviewing for you your first aligner delivery appointment. Invisalign is an exciting journey, and all of the habits that you're going to need to be successful with it will be reviewed with you in today's appointment. If you're considering Invisalign, this is a great video to watch because it will tell you what it will be like to live with Invisalign treatment. I've done Invisalign treatment myself, and so does the majority of our staff here. So if you have any questions, feel free to ask us when you're at this appointment. First things first, I always like to show my patients what their aligners are going to look like before they go in their mouth. This is what they look like. You'll notice one difference for our aligners than other aligners, and that's that they have these blue compliance indicator tabs. These will help you monitor your own progress in Invisalign treatment. The number one rule in success is that you have to wear the aligners between 20 to 22 hours a day. These little blue dots will actually fade if you're achieving the correct number of hours. We like to show our patients that because it can help them self-monitor while they're at home. Before I get started in having the patient try in the aligner, I'm going to let them play around with it a little bit. It's important to see that these aligners have flexibility. You can move them and twist them. The closer these puppies get to your mouth, the more rigid they'll feel. So it's good to keep in the back of your mind that they do have some mobility to them and flexibility. You're not going to hurt your teeth by putting them in your mouth, and it's highly unlikely that you're going to hurt the aligner either. So keep that in mind. Once you get the aligners in your mouth, we do recommend to all of our patients that they use something called an aligner chewy. The aligner chewy helps to seat the aligner fully on the teeth. A lot of times when you first put an aligner in your mouth, especially if it's a brand new set, you're going to want to bite down and squeeze. Well, we don't want you to do that. Instead, we want you to use this little aligner chewy. What you'll do is put the aligner in your mouth, put the chewy inside of your mouth, and do constant, firm pulsations on the chewy to help the aligner fully engage. We found that this is critical in our treatment, and we ask that our patients try to use the chewy for 3 minutes 3 times a day. We never want you to wear out your jaw, but we do want to make sure that those aligners are sitting fully around the teeth. It's really important that you remove your aligners before eating anything. Any chewing with them in can distort the aligners. We don't want that to happen. As far as drinking goes, you can drink as much water as you want with the aligners. The one rule is that it has to be room temperature or cooler. You never want anything hot to touch the aligners. The second thing is if you eat anything or drink anything with color, it will have the ability to stain it. So you'll want to try to avoid that as much as possible. If you do drink anything with color, we recommend just rinsing with water immediately after having that sip of whatever beverage it was that you choose. Next, we're going to cover cleaning your aligners. If your aligners do pick up any stain, the best thing you can do is have really good cleaning habits to help remove those immediately. My recommendation is to treat the aligners as an extension of your teeth. Whenever you would normally brush and floss, you're going to want to brush your aligners. Using regular toothpaste is fine. Once a week, you may want to get a little deep clean on your aligners. Our recommendation is to use retainer cleaner, and we've provided you with a sample when you come in for your first aligner delivery. The easiest thing to do is just to have a glass or a mug that's dedicated strictly to your aligner cleaning. You're going to put your aligner in the bottom, put the Alka-Seltzer type tablet at the bottom or in the cup, and fill it up with cool water, again room temperature or cooler. You'll let it sit in there for about 5 minutes, 5 to 10 minutes, until the liquid turns blue. That's an indicator that it is done with its cleaning session. Then you'll want to brush them just the same way you would as if you were brushing it with toothpaste. Those are going to help get them really clean. Another insider tip that we found at Complete Dental Health, if you don't have retainer cleaner, a great alternative is to use a dilution of Clorox bleach, just household bleach, and water, and use that as your retainer cleaner instead of the tablets. Soreness is normal during the first few weeks or during the first few days of wearing your aligners. But if you develop sores on your lips, tongues, or cheeks, we're going to want you to call our office immediately so we can see if any adjustments are made. So don't be afraid to call us. If something is going to happen, we want to make you as comfortable as soon as possible. We're going to give you 2 retainer cases. One you're going to want to just take with you everywhere you go. There's a nice convenient reminder on the inside that optimal wear is going to be 22 hours. The second one is going to be for your backup or emergency aligners. If you should lose your aligners, we're always going to want you to have an aligner set ready to go into. We recommend putting your backup aligners in the red emergency case. You can keep this at home, or if you're traveling, be sure that you take it with you. If your aligners are to crack or break, call the office as soon as possible so that we have the ability to get you in and see if we need to order some additional or replacement aligners. If you lose your aligners, well, the good news is when you do your Invisalign treatment with Complete Dental Health, you actually get 3 free replacement sets. So give us a call immediately. We'll find out if replacements are needed and get those to you in a timely fashion. That's pretty much it for the do's and don'ts of Invisalign treatment. We look forward to your next visit when we'll check to see how your progress is going.